Unity Point Weight Management Specialist thanks you for your interest in bariatric surgery. Today we would like to discuss how our bariatric program can help you achieve your weight loss goals. By the end of this presentation, you'll have a clear understanding of how the program works and the steps you can take to start your journey. What is obesity? Obesity is a complex and chronic medical condition characterized by excess accumulation of body fat that may negatively impact overall health. Obesity is measured with BMI, or body mass index, which is a measurement of an individual's weight in relation to their height. A BMI of 30 or greater indicates obesity. Obesity can result from a combination of factors, including genetics, lifestyle choices, hormonal imbalances, and environmental influences. In order to determine your BMI, your doctor will take measurements of your height and weight and then cross-reference them on a chart like this to determine your exact BMI. Having too much body fat can lead to a number of acute and/or chronic health conditions, such as high blood pressure, type 2 diabetes, heart disease, stroke, osteoarthritis, certain types of cancers, sleep apnea, gallbladder disease, retinal disease, liver disease, as well as overall difficulty performing activities associated with daily living. Weight loss offers numerous health benefits that can significantly improve a person's quality of life. Shedding excess weight can lead to increased mobility, making everyday activities easier and less painful. It often results in a decrease in blood pressure and improved blood sugar levels, which may reduce the need for medications to manage conditions like hypertension and diabetes. For patients with obstructive sleep apnea, weight loss can improve sleep patterns by reducing pressure on the airways, leading to a better rest and overall energy levels. Additionally, achieving a healthier weight is linked to a brighter, more positive outlook on life, often increasing self-confidence and mental well-being. These improvements together create a strong foundation for long-term health and happiness. Traditional weight loss strategies typically include nutrition, intervention, physical activity, and in some cases, drug treatments. Nutrition intervention focuses on adopting a healthy, calorie-controlled diet to reduce excess energy intake while emphasizing nutrient-dense foods such as fruits, vegetables, lean proteins, and whole grains. Physical activity plays a crucial role in weight loss by increasing calorie expenditure, improving cardiovascular health, and building muscle mass to boost metabolism. Drug treatments may be used to aid in weight loss as well. These medications prescribed under medical supervision work by suppressing appetite, reducing fat absorption, or influencing metabolic processes. Weight loss surgery, when combined with diet and exercise, is widely regarded as the most effective approach for achieving significant long-term weight loss for individuals with severe obesity. Unlike traditional methods, bariatric surgery addresses the underlying biological factors that make it challenging to lose weight and maintain it through diet and exercise alone. Surgery is only a tool to aid in weight loss, not a guaranteed solution. Long-term success depends entirely on a patient's commitment to adopting a healthier lifestyle. This includes making consistent, mindful choices about nutrition by prioritizing balanced, portion-controlled meals and avoiding high-calorie, low-nutrient foods. Regular physical activity is equally essential as it helps maintain weight loss, improves physical fitness, and supports overall well-being. Additionally, staying engaged with the weight loss management staff is critical. Their guidance ensures you're on track, addresses challenges, and provides support through every stage of your journey. Surgery provides a powerful starting point, but true, lasting success comes from embracing these lifelong changes and working collaboratively with your care team. Before you start any physical activity, make sure you answer the following questions. Has your doctor ever said that you have a heart condition and that you should only do physical activity recommended by a doctor? Do you feel pain in your chest when you do physical activity? In the past months, have you had chest pain when you were not doing physical activity? Do you lose your balance because of dizziness, or do you ever lose consciousness? Do you have a bone or joint problem that could be made worse by a change in your physical activity? Is your doctor currently prescribing drugs for your blood pressure or heart condition? Do you know of any other reason why you should not do physical activity? If you answered yes to any of these questions, consult with your primary care provider before beginning an exercise program. Unity Point Weight Loss Management Specialists offer both surgical and non-surgical options for weight loss. Surgical options include the sleeve gastrectomy and the Roux-en-Y gastric bypass. The sleeve gastrectomy is a surgical procedure designed to promote weight loss by altering the size and function of the stomach. During the procedure, a significant portion of the stomach is removed, including the area responsible for producing most of the hunger hormone ghrelin. This reduction helps decrease appetite and control hunger more effectively. The remaining portion of the stomach is shaped into a slender tube or sleeve, which is then stapled securely. The Roux-en-Y gastric bypass is a surgical procedure that helps achieve significant weight loss by altering the stomach and digestive system. During the surgery, the stomach is divided into a small upper pouch and a larger lower portion. The small pouch, which holds much less food, becomes the new stomach. The surgeon then cuts the small intestine and connects it to the small pouch, bypassing most of the original stomach and the first part of the small intestine. Early complications are the same for the sleeve gastrectomy and the Roux-en-Y gastric bypass and include leaks, DVT, pulmonary embolism, bleeding, and wound infection. Long-term post-surgical complications vary for each procedure. For the sleeve gastrectomy, suture line bleeding, suture line leakage, and gastric strictures are most common long-term post-op complications. In the Roux-en-Y gastric bypass, the list of long-term post-surgical complications include hernia, marginal ulcers, bowel obstruction, vitamin mineral deficiencies, and dumping syndrome. Now it's time to meet our surgeons. Dr. Melinda Haas is a board-certified general surgeon who graduated from the University of Iowa's College of Medicine and completed her surgical residency at Mayo Graduate School of Medicine. She has completed over 800 lifetime bariatric procedures and is the medical director of our bariatric program. Dr. Siegel is a board-certified general surgeon who graduated from the Albert Einstein College of Medicine and completed his bariatric and minimally invasive surgery fellowship at the University of Iowa. The only program requirements are that the patients are over the age of 18 with a BMI of at least 40 or a BMI of 35 to 39.9 and have one or more severe obesity-related health problems or comorbidities such as hypertension, diabetes, sleep apnea, or other. Please note that there are some insurance companies that are lowering their BMI requirements. Candidates for bariatric surgery must meet specific criteria, including having a history of attempting weight loss through traditional methods, such as diet, exercise, or medication, but achieving only short-term success. Surgery is not a quick fix. It requires a lifetime commitment to making drastic and permanent changes to eating habits and overall lifestyle. This includes adhering to a healthy, portion-controlled diet, engaging in regular physical activity, and maintaining a strong focus on long-term wellness. Surgical candidates must also be willing and able to attend all post-operative follow-up visits, which are essential for monitoring progress, addressing complications, and ensuring the best possible outcomes. Additionally, candidates must undergo various preoperative evaluations, including medical tests and clearances, to ensure they are physically and mentally prepared for the procedure and its demands. This comprehensive approach helps ensure that patients are fully informed, supported, and ready to succeed in their weight loss journey. Things that could disqualify you from having bariatric surgery include, but are not limited to, excessive surgical risk, inadequate trial of diet and exercise, non-adherent to the bariatric program, and/or having 3 or more no-shows or cancellations, unwillingness to make the necessary lifestyle changes to diet and exercise, the inability to understand and follow program guidelines or diet, current alcohol, drug use, or smoking, having an untreated eating disorder, uncontrolled psychiatric disorders, active or certain types of cancer, previous Nissen fundoplication, end-stage retinal, hepatic, cardiovascular disease, Crohn's disease, cirrhosis with portal vein hypertension, or lupus. Bariatric surgical candidates must quit smoking nicotine and/or marijuana at least 3 months prior to surgery and must remain tobacco, nicotine, marijuana-free for life. Part of the surgical clearance involves screenings for nicotine and marijuana. If this test returns positive, surgery will be canceled. Bariatric surgery is not a quick fix for weight loss. It's a powerful tool that requires significant lifestyle changes and a strong commitment to achieve long-term success. Patients must be prepared to adopt a healthier diet, incorporate regular physical activity, and maintain these changes for life. The process is not immediate. Bariatric surgery typically involves 4 to 12 months of preparation, including consultations, medical evaluations, nutritional counseling, and psychological assessments to ensure readiness for the procedure. Success depends on dedication to the program and a willingness to embrace the lifelong habits necessary to achieve and sustain weight loss. The first step on the road to having bariatric surgery is to watch the educational seminar. Congratulations, you've already completed the first step. Before completing the online or paper forms for our weight loss management team, please contact your insurance company to ensure that bariatric surgery is a covered benefit for your plan, as well as our facility and surgeon are in network. Please note that all copays and out-of-pocket fees assigned by your insurance are the patient responsibility and will be collected at the time of service. Once you have that information, please submit the online paper bariatric form. Once you receive your form, we will also contact your insurance company to ensure that you have bariatric coverage as well as identify program requirements that must be complete before surgery is authorized. Once we have your insurance requirements, one of our dedicated staff will contact you to schedule for your initial consult with the surgeon of your choice. At the first visit, the surgeon and care team will discuss your medical history, weight loss goals, and determine your eligibility for surgery. Before leaving the office, after your surgical consult, our staff will schedule you for a group nutrition class with our nurse practitioner, Tracy Rocky, who has completed additional training in nutritional counseling and healthy living from Cornell University. After the group nutrition class, if you decide to continue down the weight loss path to bariatric surgery, you will pay the non-refundable fee of $200 to join our program. Now that you've paid the bariatric program fee, you will continue on your weight loss journey by beginning to work through your list of requirements provided by your insurance company. Our weight loss management staff will facilitate all testing, treatment, and ongoing appointments to help you work through our program successfully. Our team, dedicated weight loss experts, will guide you every step of the way, while also offering tons of support along your journey. Once you have completed all insurance requirements and you are ready for surgery, your chart will be submitted to your insurance company for surgical prior authorization. This authorization takes anywhere from 2 to 6 weeks for our staff to obtain. Once we receive the authorization, your nurse will call you to schedule your bariatric surgery. Once your bariatric surgery has been scheduled, the nurse will send you in the mail and/or via MyChart your surgery instructions. An important part of these instructions is your pre-op liquid diet. 2 weeks before surgery, you will be on a high-protein liquid diet to decrease the size of your liver. During this 2 weeks, you will also be allowed to have clear, sugar-free liquids. There is a comprehensive list of permissible liquids within your surgical patient education materials booklet that you will receive when you join the program. The weight loss management team will also be available to assist you in preparing for this diet. When surgery day finally arrives, your procedure will take place at Unity Point Health Trinity Rock Island location. You should plan to stay in the hospital for 1 to 2 days depending on the weight loss procedure performed, as well as how you maneuver through the recovery process. Discharge criteria is determined by multiple factors such as pain control, mobility, oral intake, and retention. Post-operative care in the hospital after bariatric surgery is designed to ensure a safe recovery and successful transition into the next phase of your weight loss journey. Pain is managed with appropriate medications to keep you comfortable, while anti-nausea treatments help minimize discomfort. The surgical team closely monitors your incisions, providing guidance on how to care for them and prevent infection. A swallow study may be conducted to ensure your new digestive system is functioning properly before you begin a sugar-free, clear liquid diet. Early walking after surgery is encouraged to reduce the risk of blood clots and promote healing. Most patients can expect to gradually resume normal activities and return to work within 2 to 6 weeks, depending on the type of procedure and overall progress. This comprehensive care ensures a strong foundation for recovery and long-term success. Follow-up appointments after bariatric surgery are mandatory and play a critical role in ensuring your long-term success and health. These appointments are scheduled at specific intervals, 7 to 10 days, 1 month, 3 months, 6 months, possibly 9 months, 12 months, and then annually thereafter. Each visit allows your bariatric team to monitor your progress, assess your nutritional status, and address any challenges or complications that may arise. Congratulations, your wait is over, and our weight loss management team is here to help you through this process as quickly and easily as possible. If you're ready to commit to this lifestyle change, give your insurance a call to verify bariatric surgery coverage. Fill out our online form, and one of our dedicated staff members will contact you to begin your journey.